Namaste students, हमेशा खुश रहो बिटिया. I am JV'n's Dr. Neeraj Dholia, Faculty of Agriculture and Veterinary Science, Jayoti Vidhyapeeth, Women's University, JV'n. So today we will discuss the topic that is the communicable and non-communicable diseases and AIDS. So this topic comes under the subject medical biotechnology. So what is this disease? So it is acquired immunodeficiency syndrome, and it is a chronic disease, and in which in this disease it is caused by a virus, that is the human immunodeficiency virus. So because it is a immunodeficiency virus, so it uh, hampers your immune system, it damages the immune system, and it interferes your ability to fight with the infections and the diseases. So it is a STI, sexually transmitted infection, and it can also be spread by the contact with infected blood or from mother to child during the pregnancy and childbirth and breastfeeding. So the medications can slow down the progression of the disease, but there is no foolproof treatment for this disease. So the sign and symptoms of this disease depends on the phase of the infection. So in the primary infection, that is the acute HIV, uh, and when the virus enters in the body, and uh, in the around 2 to 4 weeks, the patient may have the mentioned symptoms, like it may have the fever, headache, muscle ache and joint pain, rashes, sore throat and painful mouth sores, the swollen lymph glands mainly on the neck, and diarrhea, weight loss, cough, night sweats, etc. So the other type of phase, or that is the clinical latent infection. So after the infection, the virus may uh, be present in the body of in the especially in the white blood cells, and it will not show any symptoms. So this is known as the latent infection. So in this stage of the infection, HIV is still present in the body and in white blood cells. And however, in many people may not have any symptoms or infection during this time. So this is known as the latent infection or latent period of the virus. So symptomatic HIV infection, as the virus continues to multiply and destroy your immune cells, the cells in your body that help fight to germs, you may develop mild infections or chronic signs and symptoms. So because this virus attacks on the white blood cells, which are your immune cells, so your immune cells get the weakens, and you may uh, very oftenly can get the infections. So the symptoms the patient may feel are the fever, the fatigue, the swollen lymph nodes, diarrhea, weight loss, oral yeast infection, and shineless, and the pneumonia. So further, the progression of the AIDS. So the antiviral treatments is very most important in the uh, in controlling the AIDS disease. So most people with HIV in the US today don't develop AIDS. So untreated HIV typically turns into AIDS in about 8 to 10 years. So when AIDS occurs, the immune system has been severely damaged, and it is more likely to develop the opportunistic infections and opportunistic cancers. So diseases that wouldn't usually cause illness in a person with a healthy immune system. So The sign and symptoms of the disease infection may include the sweats, chills, recurring fever, chronic diarrhea, swollen lymph nodes, persistent white spot or unusual lesions on your tongue or in your mouth, the persistent unexplained fatigue, weakness, weight loss, skin rashes or bumps. So these are the signs and symptoms of the AIDS. So hope you are satisfied with this detailed session, and if you have any query, please write in the comment box. And this session is powered by Digital Version 2, Jyoti Vidhyapeeth Women's University, Jaipur. Thank you.